All right, the first thing we're going to do with a CRM is I'm going to show you how to grade the severity and location of a simple sprain. Take a look. Okay, grading the severity of a sprain is really simple with CRMA report. You're just looking at how much excessive motion there is. And I'll show you in a second how, what excessive motion is normal and what's abnormal and what's rateable or severe. When we say rateable, it means it just qualifies for impairment rateable levels of excessive motion. So I say rateable. Rateable is severe excessive motion. So right now it says here that we have moderate at C2, C3, C3, C4, and C6, C7. Those would be grade 2 sprain findings. It says that we have severe at C5. So, when we look at this, we actually go, okay, how does this correlate? Well, if we look at research says that we can actually determine the severity and location of sprains based on how much excessive motion there is. So it says when force is subjected to a ligament or two, great failure occurs, resulting in drastic changes in the structure and physiology of the joint. Get the fact that they're making this a very significant condition. Ligament injuries, also called sprains, can occur due to direct trauma and are evaluated on a scale from grade 1 to grade 2. Grade 1 sprains consist of mild stretching of the ligamentous tissue with no discontinuity of the ligament or clinical signs of excess laxity. So that would be less than 1 millimeter of translation or less than 7 degrees of angular finding change. Grade 2 sprains have moderate stretching of the ligament with some torn fibers, but enough are intact so that damaged ligament is not failed. However, joints with grade 2 sprains have an abnormal laxity compared to the uninjured side. So basically what it's saying is that if you have abnormal laxity, anywhere from 1 to 3.5 in the cervical spine, 1 to 4.5 in the lumbar spine, if you have abnormal laxity, then basically you have a grade 2 sprain finding. It says grade 3 sprains consist of severe tearing and nearly complete or complete ligament disruption with significant joint laxity. Now, the ligament could be disrupted, but there's other ligaments, there's other check ligaments in the spine. So let's say you have a ligament of flavum that has it's avulsed, it completely separated. It doesn't mean the other ligaments are separated. That's why you use excessive motion. So on grade 3 sprains, you're basically looking at anything that's above 3.5 millimeters in the cervical spine or above 4.5 millimeters or 4.5 millimeters or above in the lumbar spine, 3.5 millimeters or above in the cervical spine, and angular differences greater than 7, 7 to 11, or greater than 11 or greater in the cervical spine. And in the lumbar spine, the numbers are a little different, but it shows you right in the report what you have as far as normal, abnormal, or rateable. So you just look at the charts. So in this case, we'll just look at a lumbar study. We can look at a cervical study or a lumbar study. It just says, look, if I've got abnormal findings, first of all, I've got a rateable finding. So I've got a grade 3 sprain finding at L3. Now I also have some abnormal findings. I have some abnormal findings that are significant at L3, L2, L2-3, L1-2, L2-3, L3-4. So when I have abnormal findings, it's grade 2 sprain finding. When I have rateable findings, it's a grade 3 sprain finding. It's just that simple.